Biseach is an old Irish word which means to improve or to heal. All great cancer research begins and ends with a clinical problem. And in the west of Ireland, we have great exposés of clinical problems that are relevant to cancer outcomes in the world. We've a very high incidence of cancer. We've a dispersed and aging population. Cancers present late here, and we also have the kind of genetic background with the endemic population here that makes it an ideal test ground for important cancer research questions. And I think in the context of the Biseach Initiative, it gives an opportunity for two major research collaborations to come together through the University of Galway and the Harper Cancer Research Institute to try to heal cancer in the world, but more especially to improve outcomes here in the west of Ireland.
The cancer outcomes in the west of Ireland are the worst in the country for multiple reasons. Access to healthcare, economic deprivation in some of the more rural regions are part of the problem, but we're really interested in what's the biological basis for those poor outcomes for the increased incidence in cancer in the west of Ireland, as we are in South Bend region as well. So some of the ideas that we've been thinking about at Notre Dame, we were able to talk about here and to try to put those minds together and come up with strategies that we can look at using, for example, the biobank at the Lamb Institute that has tissues from cancer patients in the west of Ireland, with some of our great researchers that look at the molecular basis of what those disparities might be, and try to identify really important questions like, why do some women survive breast cancer 20 or 30 years, whereas some with the exact same diagnosis succumb in a couple of years?
Well, as we sit here in the Lamb Institute, you're sitting in a translational research environment. It's located in the grounds of the University Hospital, where the Cancer Centre for our region is located, and we have biospecimens and major biobank of tissues taken from cancer patients. This is an amazing opportunity for us to be able to translate research findings from the bench to the bedside.
So I think what we from Notre Dame and the Harper Cancer Research Institute bring to the equation is we are interdisciplinary by design. So we've brought, on the Notre Dame end, we've brought people from all over campus, from science, from engineering, from mathematics, from chemistry. Bringing this to Galway, they have strong engineering, they have strong clinical colleagues. We have this beautiful space at Kylemore Abbey Global Center where we can get inspiration, and if you throw a bunch of scientists together in a room like this, great ideas are going to come out of it.
For Notre Dame Global, Biseach is an example of doing impactful research in a location that we exist in. And so it's a global thinking, but local impact as well. It's an example of an initiative that hits on all levels, from the undergraduate to the graduate and to the faculty collaboration. By existing here, by planting the Notre Dame flag here, we've committed ourselves to, I suppose, a legacy here. It's a big responsibility, but I think the rewards are immeasurable.